Sinusitis, also known as sinus infection or rhinosinusitis, is a very common condition where the paranasal sinuses are inflamed, causing congested nose, headache, and facial pain. Paranasal sinuses are air cavities in the bones of the skull. There are 4 pairs of sinuses located at either side of the head. They are the maxillary, frontal, ethmoid, and sphenoid sinuses. The sinuses are lined with respiratory epithelium producing mucus. The mucus drains into the nasal cavity through small openings. Impaired sinus drainage has been associated with inflammation of sinuses. When a sinus is blocked, fluids build up, making it a favorable environment for bacteria or viruses to grow and cause infection. A typical sinusitis symptom is described as a dull pain or constant pressure commonly localized to the affected sinus. The pain may worsen when the person bends over or while lying down. Symptoms often start on one side of the head and spread to the other side. Acute sinusitis may also be accompanied by thick nasal discharge of yellow-greenish color. Sinusitis may have different causes. These include allergy. Allergens such as pollen, pet dander, may trigger inflammatory response of the mucosa of the nose and sinuses, resulting in excess mucus production, nasal congestion, sneezing, and itching. Infection. Infection usually occurs as a complication of a common cold. Impaired sinus drainage due to inflammation of nasal mucosa during a cold often leads to infection of the sinus itself. Cold-like symptoms plus headache, facial pain, or pressure are common complaints. Other conditions that cause blockage of sinus drainage. These include structural abnormalities such as deviated nasal septum, formation of nasal polyps. Treatments vary depending on the cause of sinusitis. For allergy, intranasal corticosteroids are commonly used. For viral infection, symptom relief medications such as nasal spray for irrigation and decongestion. Other conservative treatments for common colds such as rest and drinking plenty of fluid. For bacterial infection, antibiotics may be prescribed. For recurrent or chronic sinusitis due to structural abnormalities or nasal polyps, nasal surgery may be recommended to clear up the drainage canal.